Good morning, ladies and gentlemen. Thank you, Andrew, for that very kind introduction. I've got a few words to say and before we move into the next piece. I'd like to also thank Reform, think tank, for giving me the opportunity to set out the thoughts on the challenges facing private healthcare in Britain today. Given your thought leadership in this area, I'm delighted we're able to partner for today's event. And we look forward to hearing from Nick and Paul, as well as any others around here who have kindly joined in the audience today. As you know, as Andrew's just said, I took over the helm at Bupa Health Funding, that is Bupa's UK health insurance business, in January, having previously run Bupa's business in India and in Hong Kong. I must say the interesting contrast between the sights and smells of Delhi's many bazaars and the imposing terraces around here in Wimpole Street it couldn't be greater. But I'm not new to private healthcare here in the UK. In fact, I started my journey in Bupa way back in 1994, and some would say I'm almost a veteran. I'm a medical doctor too, and one of the reasons for me joining Bupa was that I felt I was able to deliver what is a great purpose that Bupa has, helping people live longer, healthier, happier lives. Bupa was founded here in the UK in 1947, and now we're an organisation representing over 2.3 million insured customers and paying for about 3.5 million treatments a year. We are and will remain committed to the long-term sustainability of private healthcare in the United Kingdom. There is no question of this as far as I'm concerned. Millions of people in this country today enjoy a peace of mind, choice, fast access, and excellent quality that private healthcare brings them. But the number of people with private health insurance is falling. In the last 5 years, over 700,000 customers have voted with their wallets and left the market. And there are many more people who would love access to benefits of private healthcare, but are being priced out of the system. Since returning to the UK, I've learned that the number of insured is the same as it was back in 1995. That's why I say it's clear that the private healthcare in the UK is in need of reform. Fundamentally, we need to grow the sector and rejuvenate the interests in private healthcare. For too long, the private healthcare sector has been complacent, believing that there would always be a demand for private complements to the NHS, whatever the scale of premium rises. Today, that complacency must end. The private healthcare sector in the United Kingdom needs to innovate and change, so we can champion quality, demonstrate value for money, or face a future where it contracts into possible irrelevance as a luxury for the very few. This is not what customers tell us they want, and it's clearly not what the industry wants. So why is this happening, and what can we do about it? I believe the sector is facing three key challenges. First, a continuous challenge on quality. The sector needs to be more transparent about treatments, about treatment choices, health outcomes, to help deliver even better quality. Second, the sector needs to recognise that commissioners with healthcare expertise both have the right and a responsibility to their customers to intervene in the market to deliver better quality and value treatment. And third, the sector needs to be much more obsessive about improving value for money for customers. Turning to the first point, transparency of information to drive quality. Our customers tell us that they expect us to champion quality on their behalf. But to drive improvements in quality, you need information. At the moment, there is insufficient information about the activity and quality in private healthcare. This affects the sector's ability to ensure we're only delivering the best quality healthcare, and importantly, to prove we're delivering the best quality healthcare to our members. We need to continuously demonstrate why people should pay extra for their healthcare to complement the care that is already available on the NHS. We know as patients take a more active interest in their healthcare, there is a greater expectation of the availability of transparent information and choice through the system and the informed nature of that choice. People expect the NHS to make information about outcomes available. Our customers rightly demand the same or more from the private sector. In fact, a recent survey showed that 84% of our Bupa customers I think that consultants should ensure that patients are aware of outcome data for their treatment and the consultant success rate for that treatment. At Bupa, we use information to match the specific needs of the patient with the most appropriate hospital and consultant, ensuring we only fund treatment and care for our customers that reflects the best medical practice and meets published evidence-based guidelines. Our information helps us to see unexplained variation in treatment patterns. This can mean overdiagnosis and treatment, worse outcomes for patients, higher costs, which drive up increases in our premiums for our customers. To tackle this, last year we introduced medical reviews in areas where we saw unexplained treatment patterns, including knee and shoulder surgery. Through these reviews, we managed to help our customers avoid over 3,000 potentially unnecessary operations. We have the support of our customers. More than 3/4 of them believe that the health insurers should use medical evidence to help prevent patients from undergoing unnecessary and ineffective treatments. But more needs to be done. Due to a lack of published information, the industry is being held back from pursuing and demonstrating high-quality healthcare. That's why we're championing the collection of clinical outcome data for our customers. We're continuing to drive improvements in clinical governance, and we're encouraging the sector to take more responsibility for delivering better outcomes for patients. Growing as a sector will only happen when we work together to drive greater transparency of information in this way, so we can consistently demonstrate the excellence of care we provide through objective and transparent data. This brings me to the second point. The sector needs to recognise that commissioners with healthcare expertise have both a right and a responsibility to their customers to manage treatment and care. We need to design and deliver consistently better healthcare for our members. Healthcare that puts them at the heart of the decision about their treatment and care. To illustrate, let me tell you about Fiona, a Bupa member who runs a riding school in Cambridge. Last year, she was diagnosed with spinal stenosis, where the spinal column narrows and causes pressure on the spinal cord. Fiona's consultant recommended spinal surgery. After talking to our specialist treatment options service, Fiona received more information about the other treatment options available and decided that a course of pain management was right for her at that time. It meant that instead of taking 4 to 6 months off to recover from an operation, she can manage her pain herself, continue to spend time with her horses, and could keep her riding school open. So why am I telling you about Fiona? Because Fiona's story shows how patients should rightly expect to be able to discuss their healthcare options and make informed decisions about their care. Because sometimes, given time and the full facts, patients may want to choose a different route that is more suitable for them. For example, allowing them to maintain their livelihood. So we're trying to fill these gaps and give our members the support they need to drive often life-changing options for them. As Fiona herself said, it's great that they have the time to listen and explain everything. They spoke to me like a person and not a number, and gave me the confidence to make a better decision about what treatment was right for me. We also have specialist patient support teams for members with conditions like cancer, heart disease, as well as back pain. Our nurses support and guide customers through what can be very worrying times. Commissioners of healthcare like Bupa have the expertise and the responsibility to be involved in their customers' care. Without this involvement, we cannot design and deliver consistently better healthcare on their behalf. So we wouldn't be able to do things like change care pathways for muscle, bone, and joint conditions, as well as mental health, to get customers straight to the support they need without needing to wait for a GP referral. That's why I'm committed to working with forward-thinking doctors and hospitals to do more to ensure that our customers get the treatment and support that is right for them. Turning to my third point, value for money. Health insurance premiums have been rising by unsustainable levels due partly to increasing treatment costs, but mainly because of the lack of competition in the healthcare system. Bupa's spend with private hospitals and consultants is now double in real terms what it was back in 1995. This situation is not sustainable or fair. If we think we can simply meet increasing costs by raising premiums, the industry will ultimately fail. Bleeding the patient is not the cure for this sector's ills. What the sector needs is strong intervention from the Competition Commission, which is currently investigating the private healthcare market. We would like more competition and accountability amongst private hospitals and consultants to help reverse the decline in customer and patient numbers. The way the private hospital market works has driven up costs without delivering efficiency for customers. Since 1995, private hospitals' revenue has grown at 132% in real terms, while occupancy remains low. In the UK, the 5 main hospital groups own 80% of the private hospital capacity. So we're calling on the Competition Commission to drive fundamental changes in the private healthcare hospital market, so we can give more customers access to great healthcare for a better price. But we're not waiting for this to happen. We're listening to our customers. 87% of them expect us to pursue value for money on their behalf. 84% of our customers think that health insurers should monitor consultants and hospitals to ensure high-quality care is given and the costs are managed. So we have a duty to tackle this on behalf of our customers. Let me give you some examples of what we're doing. Since last year, we have been reviewing the level of skill, medical risk, time, and complexity of surgical procedures we fund. We want to ensure that the prices we pay on behalf of our members are fair and take into account all of the medical advances. We found that we were paying too much for some procedures and not enough for others. For example, we were paying an equivalent of more than £2,000 an hour for cataract surgery, which is now one of the more routine operations in the country and only takes about 20 minutes. This is more than consultants charge per hour for complex brain or heart surgery. So it's only fair we reduce what we pay for cataract surgery to bring it into line with other similarly complex operations. But let me be clear. Where medical evidence shows it is justified, we're equally prepared to increase our fees for many other procedures. And we have done so. For example, we now pay £1,730 for mastectomy for breast cancer with reconstruction, where we used to pay £837. One of the other ways we're driving better patient experience and quality to tackle rising costs is open referral. We pioneered this new service in the private sector thanks to the request of a major corporate client of ours. When we introduced it to the rest of the market, 8 out of 10 of our business customers decided that open referral was right for them too. And many of our competitors have now followed suit. Why is it so popular? Because, quite simply, open referral guarantees that employees won't be charged unexpected top-up fees from their consultant. And there are more than 12,000 consultants to choose from. Top-up fees, known as shortfalls, are one of the biggest sources of complaints from our customers. Not only does open referral give employees peace of mind about costs, it also gives them real choice because they can pick from 2 or more consultants offering excellent care at convenient locations. We are able to offer open referral because we have a wealth of information about consultants, hospitals, which we use to match the patient's requirements in terms of specialty, subspecialty, type of procedure that the consultant will perform, and the care delivery that is given. In the private sector, this information is not easily available to patients or GPs, and it's one of the important ways in which we add value to our customers. There needs to be greater transparency about every step of the patient journey, so people know what to expect both financially and clinically, including the likely outcome. So far, I've talked about how the challenges of value, quality, and transparency impact the private sector as a whole. But now, I want to make 3 pledges to our current and future customers. First, I will ensure Bupa will take an active role in monitoring the quality of care. At Bupa, we don't see our role as a passive observer or simply there to pick up the bill. We want to make sure each and every patient gets world-class healthcare every time they use Bupa. And that's why we will push hospitals and consultants to publish information about their clinical outcomes. It's why we're tackling unexplained variation in treatment patterns and overtreatment, which can be dangerous, and it's why we're championing informed decision-making for patients. All of this will help our customers get the right care they need. Second, I will do more to ensure that we are there for our customers at every step of their way. We think our customers should always have the most say in their treatment, so they get the care that is right for them. And we believe an important part of our role is supporting our customers to cope with the emotional and physical consequences of their condition, not just the condition itself. We will continue to offer our customers access to the latest drugs and treatments, such as Perjeta, a new breast cancer drug approved by the European Medicines Agency just this month. We will expand our unique Survivorship Program to include all cancers, and we will train more nurses to offer support and counselling to customers as well as their families. Third, I will do more to tackle the cost of premiums. I know that some of our customers are struggling to pay their premiums, but value their health insurance far too much to let it go. In fact, 80% of them say that their health insurance is very important to them. I want to say to them that I understand and that I'm listening. Unlike other insurers or hospitals, we don't have shareholders or private equity owners. So our focus is solely on our customers and giving them access to high-quality, affordable healthcare. I want to say to our customers that I will fight for a better deal on your behalf when we negotiate with hospitals and doctors. We will do our bit, but we can't do it alone. To achieve my 3 pledges for our customers, we need private healthcare sector as a whole to reform. We need doctors and hospitals to work with us, as well as other insurers, for the long-term health of this market. The key to driving reform in this sector is greater financial and clinical accountability. Healthcare systems around the world, whether public or private, whether developed or in developing countries, are facing a combined challenge of increased consumer demand and rising costs at a time of great financial difficulty. Because of these tightening constraints, policymakers and clinicians need to be more accountable for stewardship of resources. I see our shared responsibility as careful and judicious allocation of limited healthcare resources. The responsibility to ensure quality and value for money doesn't solely sit with a funder of healthcare. In private healthcare, it is the consultant who is the gatekeeper of the patient journey, determining the value, amount, and type of treatment. This is because the consultant is responsible not only for the care that he or she personally delivers, but also for the type, amount, and location of care and the onward patient journey. That influence means each consultant has an impact both on quality as well as cost through the individual journey. Doctors in the room here today will know that this is something the General Medical Council issued additional guidance on last year, saying doctors, whether public or private, must use resources efficiently for the benefits of patients and the public. Our customers are concerned about the lack of financial information or proper consent. Nearly 9 out of 10 Bupa customers think that before their initial appointment, consultants should tell patients the cost of their appointment and any tests or treatments thereafter. This failure to ensure a patient has a meaningful conversation about financial consent is simply not acceptable. Indeed, the Care Quality Commission mandates written fee advice from hospitals, and the BMA guidance recommends similar from doctors. It was also recognised by the Office of Fair Trading's investigation into the sector last year. Let me be honest. When they're ill, patients only want peace of mind about costs, not an unexpected charge just before or even after their care. So today, I call on all stakeholders in the market to work in collaboration. After all, we share the same goal: high-quality, accessible private healthcare for more patients, and a thriving private healthcare sector that is an affordable complement to the NHS. As a sector, we don't always help ourselves. At times, vested interests have prevented the industry from innovating and responding to market needs. This needs to stop. We all need to take stock to understand our part in this process. At Bupa, we're reducing our costs and becoming more efficient. We know some of the changes we've introduced have not always been popular with some of our healthcare professional colleagues, but they're necessary to ensure the long-term sustainability of this sector. We have listened to their feedback, and we're consulting more with professional bodies when we need to implement changes. In return, we ask that private consultants and hospitals not only charge our customers fair competitive prices, but also be much more transparent about the treatment choices and health outcomes. Stewardship of resources is a fundamental role for all of us here, doctors, hospitals, and insurers. This will help drive up quality even further, increase competition, and unlock growth. We must ultimately tackle these problems together, because if the sector continues to shrink, it is patients, professionals, providers, and yes, insurers, who will be left without a vibrant private healthcare sector delivering quality and choice at a fair price. I will do everything that we can to bring up the benefits of great quality healthcare to millions more people. And that's why Bupa is embarking on an ambitious programme of reform, so we can deliver better patient outcomes and value for money. And that's why we're leading the drive for greater competition, collaboration, and clinical governance. We call on others to do the same. We need the Competition Commission to intervene to promote greater competition and accountability among providers on behalf of our customers. We need consultants to take more responsibility for the end-to-end cost of care they provide, help us deliver the stewardship of resources that our customers require. This is a shared challenge. It is one I look forward to working with you to overcome. Thank you.